Welcome back to episode 75 of Your Birth Bestie podcast. Thank you so much for tuning in today. If you have been considering home birth but feel hesitant or held back by fears about the safety for you or for your baby, this episode is definitely for you, and I'm so glad that you are here getting more informed to be able to choose the best birth setting for you. Full transparency, I am a home birth midwife, but I am not here to convince you one way or the other. I am just here to give you some information that I think is helpful about this topic. I still do often support moms in hospital and birth center settings via co-care as a midwife or support as a birth doula because it is up to you to choose the best place for you to give birth. So today we are diving deep into the most common concerns about home birth and how midwives ensure safety every step of the way. So whether you are worried about what happens if something goes wrong or questioning if home birth midwives are truly prepared for emergencies or feeling pressure to believe hospitals are the only safe option, I want to break down the evidence and share real stories that will help you feel more confident in your choices. Hey there, I'm Beth Connors, a certified nurse midwife and mom to 3 girls, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. Let's start by talking about some of the most common fears I hear about home birth safety. So these include parents saying something like, what if something goes wrong? Home birth isn't as safe as hospital birth. Midwives don't have the training or the tools to handle emergencies in the home setting. And hospitals are the only place where birth can truly be safe. So these fears that I hear all of the time are 100% valid because birth is a significant event. But when we break them down and look at the facts, we can make informed, confident decisions rather than letting fear guide us. Overall, I don't think it makes sense to think of this conversation as being black and white to which setting is safest for every single woman, because you are an individual who has values and birth preferences and a unique personal and medical history. So your birth isn't going to look the same as your sister or your best friend. So safety and risk are all relative to your beliefs and your values. But we can talk about the data a little bit too. Planned home birth for low-risk pregnancies attended by a trained midwife is supported by research as a safe option. Studies show that for healthy, low-risk pregnancies, home birth outcomes are comparable to hospital births in terms of safety. Also, intervention rates are significantly lower in planned home births, reducing the risks associated with unnecessary medical procedures like a labor induction or the use of assisted devices like a vacuum or forceps for delivery. One of my own clients was initially skeptical about home birth because of the stereotypes of home birth midwives and about safety, and her husband was not on board at first either. There was a long conversation about the role of a home birth midwife and the training involved and emergency skills that they were prepared in. It also helps to learn more about what home birth midwives are able to carry in their birth bags to your home, and then what their scope of practice is regarding the management and the treatment of emergencies or things out of the normal that happen in the home setting. And then after a long conversation and talking about her personal situation, she felt confident that home birth was in fact the best choice for her and was the most comfortable with the care home birth midwives could provide for her. This common assumption that home birth is inherently unsafe without really zooming out and looking at the bigger picture and weighing all the options and the pros and cons to all birth settings can cause a family to make decisions based on fear rather than trusting themselves and trusting the birth process. Like I mentioned before, there is a risk to everything, right? And it is up to you to decide for yourself what you're comfortable doing in your pregnancy and your birth. Hospital birth is not completely without risk either, and there are other components of being on a hospital unit that can lead to increased interventions and even less satisfaction with your overall birth experience. The next piece to this is understanding how midwives assess and manage risk, because this is a huge part when talking about how we can keep home birth safe. A common misconception is that midwives take unnecessary risks by avoiding hospitals. But I truly think this couldn't be further from the truth, or it's at least not the case for every single midwife. There might be some out there that practice this way, but this is not everybody. As a midwife, we are trained to identify risk factors early in pregnancy to then holistically manage any concerns to minimize any situations that would cause a client to potentially risk out. It is all about prevention and early detection. And that is one of my favorite things about midwifery, is that we can really focus on preventing things before they get to the point of having to be treated or medically intervening. We can just prevent all that from happening ahead of time in a perfect world, right? We are trained also to continuously assess both mom and baby during labor and recognize when a transfer to a hospital is necessary, and then make those decisions very quickly with that medical knowledge. As a midwife, I am glad to have emergent access to advanced medical care in the hospital setting, of course, when it is absolutely necessary. A transfer, in my mind, should never be thought of as a failed home birth. And your midwife shouldn't be afraid of a transfer that would potentially reflect poorly on them. It is about access to care when it is truly necessary. Nobody planning a home birth wants their plans to change, but transferring when necessary is so important to keeping moms and babies safe. And I would never consider that access of higher medical intervention to be a failure. It is just using the tools appropriately as we need them. Another fear is that midwives are not equipped to handle complications in the home. The truth is, home birth midwives bring a range of medical tools and skills to manage many situations, including fetal monitoring equipment to track baby's heart rate, IV fluids and medications to manage postpartum bleeding, oxygen and resuscitation equipment for both mom and for baby if necessary, and then, of course, knowledge and skills to manage a difficult delivery or any complications that might happen. Most of the time, birth works, but when there are complications, like in the case of increased bleeding for mom, there are protocols that midwives have to stop the bleeding and prevent further bleeding from happening, and then continue assessing and caring for her until she is stable and everyone is comfortable with the plan to stay home, or there is an additional concern and the midwife recommends transfer for additional care at the hospital. In both cases, moms can have safe deliveries and safe home or transfers of additional care when appropriate. It's important families know all about this because many people don't know that, for example, the same medications that are used at the hospital to manage postpartum hemorrhage, home birth midwives carry and can administer those as well. But without education like this, unnecessary fear can overshadow because, of course, bleeding is scary at home in an uncontrolled setting. But the truth about home birth can actually be reassuring many times to know what your midwife is actually capable of and the situations that can happen that can actually still be managed at home with their care. The next common mistake that I hear all the time is viewing the hospital as the only safe option without considering the risk of routine interventions. It is easy to overlook the benefits of a low intervention birth at home if everybody that you know has only had a hospital birth and all you hear about is how home birth is risky and about how they would rather be in the hospital where emergency intervention is available. But like we just talked about, there are resources at home to be utilized if necessary. And while hospitals can be life-saving, there's absolutely a time and a place. They also come with their own risks, right? Including higher rates of interventions like inductions, epidurals, and then C-sections that can sometimes lead to complications or even long-term issues for moms and babies. Routine procedures can disrupt that natural process of birth that is so much the center of midwifery care in the home, is keeping that natural physiological process occurring. And if that is disregarded in the hospital setting due to routine procedures, that can lead to a longer birth or a more difficult recovery. It is incredible how the body is designed to birth, and how when we leave it to happen naturally on its own, the hormones work with each other to help with things like pain management and labor progress. And then again, birth usually works when we are hands off. The less intervention is sometimes better. Usually is better, right? The last part I wanted to talk about too is encouraging you to build confidence through education and open communication to overcome any fears that you might have when considering a home birth. The more that you know about home birth, the more confident you will feel in your experience and choosing it as an option if this seems to be something you're interested in. Ask your midwife or a potential midwife if you are in the planning stages about safety protocols and emergency plans that they might have. Have honest conversations with your support team about your fears, allowing yourself to be vulnerable and ensuring that your values are communicated and respected. Because, again, in the home birth setting, it is important to have a really supportive team that really understands what you're looking for to be able to support you when the time comes, and throughout the whole process too. And then trust in your body's ability to birth naturally with this support. This seems simple, but it can actually be really challenging within the birth culture today. I would love to see this change and to encourage more moms to trust the process and feel informed with information in order to do this. And whether that's trusting your body's ability if you're delivering at home or in the hospital setting, and being able to advocate for your own body's ability to labor, or in a birth center. All of these places also, this can be a huge thing to hone in on, is trusting your body's ability and having confidence. If you have any fears or concerns of safety due to discomfort or lack of knowledge about something, definitely don't avoid talking about them. Your fears can grow and cause then more stress and anxiety during your pregnancy that can absolutely affect your labor as well. So talk it out with your partner, a doula, midwife, a friend, really anybody that will listen. The more you're talking about these things, the better you will feel going into labor. So let's recap this conversation into 5 steps that you can take today to feel more confident about home birth if you maybe have concerns or are unsure about moving forward with a home birth. So learn the evidence, look up studies and statistics on home birth safety for low-risk pregnancies. Ask questions, discuss safety protocols, emergency preparedness, and also transfer plans with your midwife or potential midwife. Choose the right provider. Find a skilled midwife with experience and a strong track record of prioritizing safety. Discuss your fears. Be open with your midwife and your concerns so they can address them with facts and reassurance all throughout your pregnancy. So these are constantly part of the conversation to lessen those fears, of course, when you're actually in labor. Weigh the risks and benefits. Consider both hospital and home birth risks to make a well-rounded decision that seems to be the best for you and your values and your situation. Because like I said, every birth is different, every pregnancy is different, and we want to make sure that you are the most comfortable and the most confident in your decisions. Thank you so much for joining me today on Your Birth Bestie podcast. If you've been struggling with fears about home birth, I hope this episode has given you a little bit of clarity, confidence, and some reassurance to make the best decision for you. Remember, birth is a natural and powerful process, and with the right care and support, home birth can be a safe and fulfilling option for you. If you are looking for more resources, head to my website, familyfocusedmidwifery.com, where I have free guides, my blog posts, and more support to help you on your birth journey. I also have a virtual group coaching program starting on March 1st if you're interested in chatting with me on Zoom and planning for an empowered and confident birth experience, no matter if you are choosing a home birth, a birth center birth, or a hospital birth. So click on the link in the show notes for all the details on what's included. Thank you so much again for tuning in, and I will be back here next Tuesday with another episode. Bye, everyone.